and good morning to everyone. So it's my great pleasure to welcome you all to the VACCELERATE Showcase Event, where we will be discussing about the Horizon EC-funded project VACCELERATE. And as we begin, I'm honored to introduce the coordinator of VACCELERATE, Professor Oliver Cornely. So Oliver is a distinguished scientist with an impressive career in infectious diseases and clinical research. Oliver is also the director and chair of translational research at the CICAD Institute of the University of Cologne and scientific director of the Center for Clinical Trials. He published over 600 peer-reviewed articles and ranks among the top 1% most cited researchers, and his extensive experience and numerous contributions to the field have earned him international recognition, making him an exceptional leader of the VACCELERATE project.
Wow.
I would like to ask you, if feasible, to please mute your microphones. Last but not least, I would like to take a moment to express my gratitude to Oliver, but also the entire coordination office at the University Hospital of Cologne for their outstanding efforts over the past 4 years. Their excellent leadership, dedication, and seamless coordination have been instrumental in ensuring the success of the VACCELERATE project. And on a personal note, it has been a true privilege and pleasure to collaborate with you, Oliver, and the remarkable team behind VACCELERATE. And with that, I am delighted to hand over the floor to Oliver, who will provide us further insights into the vision, project highlights, key results, and research impact of the VACCELERATE. So thank you very much. Oliver, the floor is yours. I think you're muted. I would like to ask everyone, sorry, Oliver, for the introduction. During the presentation, yes, please mute your microphones. And of course, after the presentation, we will have much time for discussion. Thank you.
And I guess that Janina will have a number of co-hosts to help her muting the microphones of those who are on a cell phone, and sometimes we are unable to do that, right? So, okay, thank you very, very much for your really, really kind introduction, and indeed, remarkable team here in Cologne, and quite some of them over all the 4 years and even longer, like preparing the VACCELERATE application proposal back then when the European Commission approached Cologne to have this to have this, or a network, the only network on vaccines in Europe, come true. So I share my screen. You should be able to see the screen now. Now? Yeah, I guess that works. You see it? Okay.
Yes, perfect.
Well then, so showcase event. I think that's the first showcase event I ever had. So so I'd like to briefly and very rapidly, in the end, to lead you through what we have done. And of course, 4 years don't fit into 1 hour, but I'll do my best. And the team tremendously helped, of course, with preparing this. So here is my conflicts of interest, not the conflicts of interest of the of VACCELERATE or something. The VACCELERATE doesn't have such. And this is a good one because it's a really busy slide and it tells us there's a lot of vaccine work out there, and quite a number of academic or industry vaccine developers using VACCELERATE even after its official end of the funding period next Monday or so. So the agenda for the webinar today is the what is VACCELERATE. So I know that quite some of our VACCELERATE national coordinators or work package leaders and other people who were tremendously contributing to the success are online, but so for them it might be repetitive, but not for the others. And this is a broadly open public webinar today. So what is VACCELERATE? What are the services, solutions? You will see that during the entire talk, I would say some facts and figures, then the infrastructure, the volunteer registry, which is at the core of VACCELERATE, or one of the hearts, so to say. the side network and the academy likewise, and then VACCELERATE studies. I'm going to share with you the setup and the results of the AGE study. And I'm going to share the setup of the booster vac and the COVAX study, but the results are not yet published. So therefore, the results will not be part of today's presentation. And they have been presented internally. And now it's during the next days, we will see results being going public. Accelerate visibility and its challenges and its outcomes and outlook. So the Accelerate, we used created that word that didn't exist before out of vaccine and accelerate, because we were all very happy to see a vaccine as fast as never before in human history, but it's never fast enough. And so next time we want to be even faster. And that is basically the number one idea behind Accelerate. So what could be done to speed things up? And first of all, you need funding. And that funding came from the EU, and it was very generous funding, and we could really work with that. And then some microphones are not yet muted, but I'm sure the team is on it. Then it was launched in February 21. And as part of the EU response to the COVID pandemic, and the project end is January 27 this week. And so the overall intention was to bring together experts and clinical study sites and volunteers from across Europe so that they find each other ideally before a clinical trial is being started. So that when a clinical study is being started, you usually then begin to look for participants, and that we wanted in the context of vaccine studies. That time we wanted to shorten. You're looking for sites and volunteers, so that all could be done before. That was the philosophy, and that is what we did, and proved that that is actually doable. So the coordination office, or it's coordinated by the University of Cologne here in Germany, and the funding came from funds from the Horizon 2020 program, and the initial budget was 12 million euros. And then there was top-up funding because we were, after offering the platform, we were asked, well, then do clinical trials, please. Well, that was like, does it really work? It looks nice, but let's pressure test it type of thing. And so the initial budget was smaller actually than the budget for the actual clinical trials, which makes sense because the trials are what is the important work. And we started with 31 partners throughout 18 member states and 5 associated countries, and the duration was set for, well, at the beginning for 3 years, I would say, and then it was prolonged to 4 years. And so that we in total then have this 48 months here. And we do have centralized information database with information on currently 525 sites where vaccine trials can be conducted in 57 countries. I'll briefly come back to that on another slide. And we know what their capacity is, what they did so far in terms of with vaccine or outside of vaccines, and what their capability is to embark on a clinical trial. The volunteer registry actually has somewhat different coverage. It's 25 countries, and it's there in 22 languages. So for Germany, you need 6 languages to have and there are no local dialects. So 6 languages to really reach 98% or so of the population in this country. And that is, of course, for other countries similar, I guess. We do have more than 100,000 volunteers in our databases. So let me start with the volunteer registry. You can register there, and maybe not all of you are registered, so please do and use the QR code maybe that is here, or just type in vaccelerate.eu, of course, after this hour. And it's a platform that connects individuals that are interested in clinical trials and taking part in clinical trials. At the beginning, that was people who thought, if I go on a clinical trial, even placebo-controlled, then at least I have a 50-50 chance to be vaccinated in that trial. and I may be protected earlier than somebody who can only have access to after a clinical trial, after licensing. So that is what really sped things up at the beginning. But still, we did a lot of advertising, and actually, yes, really, we had that Zeppelin flying over Cologne as an as a means of advertising. And so we are doing a lot of different things, and there were massive numbers of ideas what could be done. We followed all these to advertise for the volunteer registry and to get more volunteers into the registry. And all the material was translated to many languages, 22, I think it was in total. And so that we really reach, or at least hope to reach, as many people as possible throughout Europe, and actually quite some beyond Europe. So the registration was easy. That is how the website now looks. Yes, I do want best research, and then you can go for either the newsletter or for registration and becoming a participant. There are all these flags for the different languages, and when you register, you would give certain information on, do you have any chronic disease? You can tick these boxes, your age, of course, where you live, because that is then helping with making a match to a clinical trial that then would be offered to the individual volunteer. So the multiple ways how we advertise this on multiple platforms, and it worked. As said, 107,000. So now you have the volunteers. You need to offer them something. You don't enroll 100,000 people in the same trial, and they are quite a heterogeneous group. So we thought of, apart from the several thousands that were offered participation in interventional and vaccine trials, so the ultimate goal, we need to do something for the others who are waiting for the next vaccine trial that might fit their personal medical history and location, etc. So the inclusion and exclusion criteria. So what do we do in between? In between, we go for studies that are we call them the Mach 5 studies, because quite some that we did were conducted using a multi-antigen test kit. So we all know how to swab the nose. Everybody knows that globally, I guess. And we didn't want to make people lose that knowledge. So that knowledge gain we wanted to keep. And therefore, we distributed in several studies tests that were not just what people say is a corona test, but who had more viruses on there. SARS-CoV-2, but influenza A and B and RSV and adenovirus. So some of the pathogens that often cause respiratory tract infections. So we did a first pilot with 2,000 participants in Germany, and we asked them, whenever you're symptomatic, swab your nose, take a picture of the test, and because the test is a little bit more complex than just a corona, it looks a bit different, but it's very easy to handle. So we wanted to have a photo of each of these tests and the result read by the participant, and we could then compare whether we read the same result, which was actually the case in 100%. We had over time, you see calendar weeks in the right half of the slide, the activity of the different viruses, which was really interesting and brought some remarkable results. Can't go into detail. It all has been published, and we are happy to provide more detail if you send emails or during the Q&A. So we did another one on a longitudinal assessment, so where people not only received one test, but more than one test, so that they, throughout an entire year, every time they're symptomatic, can test themselves. And for that, we had a grant that was outside of a private grant, outside of the EU funding, that was attracted by the possibility to involve only people with 50 years or higher of age. And we had 3,000 200 roughly in there, and it's an ongoing study. So calendar week 2, or actually 3, it doesn't say so because, but the last dots in this, or the end of the current curves in the graph that you see is calendar week 3. And for calendar week 4, there will be a label then again. And so this is an up and running study, and we are waiting with this almost zero activity in terms of respiratory infections. We are actually expecting that it will steeply increase with influenza just arriving. So that's roughly the things we can do. We did more with the volunteer registry, but we only have 1 hour today. So and you can go to the website, and there are all the videos linked to all the different presentations we gave. I don't know how many, a large number over the years. All the studies are being presented there as well. Usually the setup and then the results in a somewhat later video. So the VACCELERATE site network, the other part of the backbone of our work. We were tasked with setting up a site network, and I already mentioned the 525 sites, and they are from 57 countries. I admit I don't know what the number of countries in Europe is, but maybe it's not 57. So maybe somebody knows, and we will learn today. So we started, of course, as you may recall, in the European community, plus other countries in Europe that are associated with the EU. And in these strict sense, within Europe, we have 492 sites, which still is a tremendous number. But we received requests from outside of Europe, from Asia, from Latin America, from other parts of the world, asking, can't we come on board? And we said, yeah, I mean, VACCELERATE is a European initiative, but it doesn't exclude anybody, which is very European too, I would say. And therefore, this is open for everybody who wants to contribute. And that is why this is an increasing number, and it will be more than 525 at some point, I guess. So how do we work with the site network? On the left-hand side, we do have the VACCELERATE Coordination Office, and what the office knows is what their research finds, but then the research of the network and what the vaccine developers know, and the clinical trial sponsors, which may be academic, maybe industrial or other. And whenever there is a vaccine and the developer knows of VACCELERATE, that we make sure that everybody knows that, and that we exist, approaches the coordination office, requests, for example, to the vaccine developer is looking for sites for a study, then we can help with that in all these countries. Or they may need volunteers, then we would inform the volunteer and tell the volunteer there's a study next to you, a study site, and it's roughly about this and that. And if you want to know more, contact the study site, and here are the contact details. So that's the two things that we do for the sponsors of trials and for the sites in the network matchmaking. And then I'm not leading you through all this path, but of course we do have our path, how we act so that over the 4 years, things are not by chance, but follow a proper order. So the VACCELERATE site network was active in more aspects than just the core that I just reported on, making between sponsor and site and volunteers. We did other things because there were questions coming up like, what will be the next pandemic? Okay, that was not exactly the question in 2020, but it was pretty quickly, it was the question as soon as we started to cope as a global community to cope with this pandemic. We were, of course, planning ahead and asking ourselves what comes next. And apparently, Corona SARS-CoV-2 is not going to leave, but there's room for other infections. And we asked the worldwide expert network that we had built in the meantime, and with an emphasis, of course, all the European experts, highest density of experts in our network in VACCELERATE is, of course, located in Europe. And we asked them, what do you think is the next pathogen? And this is the result. So influenza virus is just leading here. Then disease X, so that is the name for the disease we don't know yet, like SARS-CoV-2. It would not have been on everybody's list because it was just a new disease. Coronavirus, yes, that would have been mentioned years ago, I guess, but who thought that it would come with such an extent? So it was interesting to ask the experts. Influenza leading, then the thought of there might be something we don't know yet, and then number 3, SARS-CoV-2 will cause another pandemic, is what 15 or 16% back then said. And the reappearance of SARS-CoV-1, that would be terrible because it has a much higher death rate than COVID-2. And then others on the list. You see them and how frequently they were named. So this raised a tremendous press echo, was selected, John Simon and Garcia being the first author, and this one was selected by ECCMID, the global ECCMID, or ECCMID Global, as it's now called, the key ID conference that takes place once a year, was selected as of high interest to the public and of worth a press release, and then that triggered a lot of interest and discussion. But basically, it didn't change. The discussion didn't change this sequence of the threads out there. So I could talk about this for 1 hour, but I'm not allowed, so I have to move on to the VACCELERATE Academy, which is another wonderful achievement, I'd say. The Academy offers a range of different educational opportunities and everything you need for a clinical trial. So there is this GCP course, and we have all heard of this, I guess, and it's something that has been there before, but now it has an emphasis on vaccines, and then all the other courses here. One I want to highlight, and that is a study nurse course, because there was no study nurse course, no online study nurse course. We learned and highlighted that the concept of what is a study nurse and how do you become a study nurse is completely different. There is no 2 countries where there is similarity. I would say in the educational pathway, if there is any, to become a study nurse. So we offered a study nurse course because while those who are not involved in clinical trials might think clinical trials are run by medical doctors, that is not the case. The medical doctors they set up the protocol, okay, and they know what should be analyzed and how should it be done. But the actual work, so 95% of the entire work in a clinical trial is done by study nurses. So if you don't have study nurses, no clinical trial. And the course is in English, and you get a certificate, and we have way over 200 people who registered there. Just saw data the other day. Infrastructure highlights. That sounds like a slide with lots of text. Let's see. Yeah. And so infrastructure highlights. So VACCELERATE's infrastructure has been leveraged in projects together with vaccine developers from EU, US, Asia as well, but that was more counseling and planning stage, but who knows what will come during this year and in the future. So we do have some unique data sources for pathogens other than SARS-CoV-2 because we added and expanded to other pathogens. The volunteer registry, I think I expanded pretty much on that. Just practically, imagine you have a clinical trial. Okay, finally you get ethics approval and regulatory authority approval, so now you could start. And then you don't really know when that approval comes. So as soon as the approval is there, you start advertising the study and finding participants. What we did, for example, in the age study that I will come back to, is that we already had appointments with volunteers where we knew they would fit into the study, they would fulfill the enrollment criteria. So the day where we received the last document needed, I think it was the ethics approval in this case, then was a Tuesday, and on Wednesday we enrolled patients, and they are not patients but volunteers. They might be healthy volunteers. We enrolled people who in that study were 80 years old and enrolled them in large numbers. And that is unprecedented, although it sounds really easy, but it has not been done before. So that is one of the VACCELERATE lessons to learn from VACCELERATE, that it's possible. Then the site network, of course, I mentioned that one extensively already, and the capacity building. So you have a site, they want to contribute to a vaccine study. They are not experienced in vaccine studies, but in other studies. So run through the vaccine-focused study nurse course. Your personnel goes through the course, and that is what we call capacity building, as one example. Other highlights, depending on how close you are to the clinical trial and the data space, and you're promoting fair data, so that the data are not only in one study and published and that's it, and you have to believe what's in there, but you can go back maybe with a new research idea, go back to these data. So they should be findable, accessible, interoperable, and reusable. And that is fair. And that is specifically fair if studies are being financed by the taxpayers' money. And it's equally as fair regardless from which source the funding comes, because there are people volunteering for taking part in clinical trials. Actually, the age study data are the first data pilot in data sharing in the data sharing repository on the slide, and that has implemented anonymization of data, and that is, as said, from the age study, and completed submission to the repository. So it's a first case where that has been accomplished. I know that ECRAN is really proud of that, proving that it works, and we are proud of having had that interaction with ECRAN, and together it worked. It could not have been done by just one entity alone, but working together, we did accomplish. So now I mentioned aged, and at the beginning, booster vac, go back. Let's have a look. Age study. So what is it about? You see the European map. We couldn't do this in 26 or so countries, or 31, all the countries that were part of it. That doesn't make sense because you need to balance between a reasonable number of countries, and at the same time we wanted to test small country, large country, north and south, etc. of Europe. So we needed some diversity on the European map there to be represented. And so that's technicalities, but what we scientifically wanted to know, participants of advanced age, 75 years or higher. In the results later, we saw that they had a mean age of 80 years. And that is a group we all remember particularly vulnerable. That are those with a higher death rate than others. It's not the 18-year-olds too, but the advanced age was at particular risk. And guess what? They have not been evaluated in any clinical trial head-to-head comparing the available vaccines. This is the only trial that ever did this until today. And that is actually still true for all three trials that go through. So we compared the two vaccines with these letter and number combinations, which is usually they are called by the company, which is kind of funny because Pfizer and Moderna, they have more vaccines than just COVID, but that is what colloquially we do, right? We say BioNTech vaccine or the Pfizer or the Moderna vaccine. So we compared Comirnaty and Spikevax. And this was planned and coordinated with Zebra from the University of Cologne. and was done in 9 cities in the 4 countries highlighted. So the results in brief, there are a lot of results, but in brief, we did have a part A where people received their vaccine as their 3rd dose. So that was done at a time where it was recommended to get 2 doses if you are for this population, 2 doses. And we thought, well, things will go on. So let's play with a 3rd dose. Let's evaluate. Let's find out. Let's do science on a 3rd dose. That is what we did. And since the pandemic was pretty fast and some challenges were quite slow, like contracting of the sites or getting the final approval from the European Commission, etc., etc. So quite a lot of things that VACCELERATE identified where things can be improved and sped up. And so the pandemic was moving on rapidly, and we changed the study protocol to a part B and enrolled 270 subjects or participants, volunteers, but we didn't ask about the 3rd dose, but about the 4th dose, because in the meantime, there was the recommendation to get a 3rd dose. And the results in a nutshell here are shown on the left. Is all of this is part A. On the left is Pfizer-BioNTech, day 1 to day 14. And the results show us that there is an increase in the antibody response, which is what we measured. Okay, we wanted to have the increase of the antibody response. And the experts know that cellular immunity and not only antibodies should be looked at. That is a learning during COVID, and nowadays we are looking at cellular immune response even more thoroughly than we did in this study. But the study showed clearly our primary endpoint was successfully met, and we could see an increase of the antibodies from day 0 to day 14. And on the left-hand side, you do see this for the part A, and on the part B is on the right-hand side. I'm sorry, it is so small. I need to increase this and have another look. We separated them in this analysis. We separated them. Sorry for that. I have to correct myself. So we separated them here. Those who had a SARS-CoV-2 infection prior to the vaccination, because imagine that was going on in parallel. The people had an infection or not, and we were not allowed to enter the trial if we had an infection over the last 30 days. But we did enroll, of course, patients who had evidence of prior infection and others. And in both groups, the antibody titer increased. And that was the case on the left-hand side with the Pfizer or Comirnaty vaccine, and with the Moderna mRNA 1273 vaccine as well, shown on the right-hand side. The VACCELERATE studies then comprise 2 more. There is the BoosterVac study, and in BoosterVac, there's a completely different question. The question is, if you're an adult 18 years or higher, so now we're not in the age population, and we wanted to examine or find out more about when is the best time point to vaccinate this person. And this is coordinated and planned at the University College Dublin in Ireland by Professor Mellon there and his team. And vaccines used, given on the slide. And this is the schedule. And remember, this is the one where I'm not going to show you results, right? So, but this is that's the results for you to be awaited. And so they randomized into 5 arms. One was the control arm. They would not get another shot. And then the other 4 arms would get another vaccination. And that is either when entering the study or 2 months later, 4 months, or 6 months later. And there were certain windows, but that's the bottom line of the study. Very interesting, because we still have the ongoing discussion. doctor, do I need another shot of the corona vaccine? So Patty Mallon will help us all answer that question appropriately when patients, when people ask, healthy or with an underlying disease. So the BoosterVac study addresses a question that is still valid and that has not been addressed so far in any other clinical trial. And here is another one that has not been conducted so far, only within VACCELERATE, and that is the COVAX study. So we did something for the adult, now we turn to the pediatrics. And in this study, children were randomized to go through two different regimens, and it was children aged 5 to 11. And we wanted to know, and that is specifically Patricia Browning from the University Medical Center in Utrecht. She's a pediatrician and a clinical trialist, and she was asking herself and getting that question by the parents of the kids, I guess, do we need another dose or not in this child? Do we need to can't we just leave it, and leave it to natural immunization or something? So there was no answer to that question back then, and the vaccines used are given on the slide, and here are the two schedules. So everybody who had a prior infection, do I need to immunize that child again? And there was a 1-dose arm and a 2-dose arm. And 31 volunteers, 31 children were enrolled. Would have loved to see more children being enrolled, but it is very, very difficult. I'll come back to that, to enroll children in clinical trials, and specifically if it's in the area of COVID-19. So that's the schedule, and not going to share the results because that Professor Browning will do at a later point. So we move to some of the last slides. VACCELERATE visibility is one thing, and the visibility, I think, is massive. We are being approached, and I'm pretty sure that national coordinators throughout the network of VACCELERATE and work package leads and others involved are being approached as well because they are part of VACCELERATE. We are being approached by industry, by volunteers, by all kinds of different entities, by press who are seeking for expertise, and for help with whatever their questions or trials are. Why is that? Why do people find us? Because we did all this, like a lot of press releases, press articles, scientific publications, a high number of these. Likely since making the slides, this is outdated because all of these are, of course, moving targets. So there's a lot of activity. And we do have our YouTube channel where, for example, the ECCMID talks are on there. Visibility through social media, X or formerly Twitter, LinkedIn, YouTube, Instagram, TikTok. We want to reach all the different age groups. So we launched Instagram and TikTok to have a better access to the younger age groups. What are the challenges? Some I mentioned. And there is a long list, which is always the case, even after a single trial, but certainly when you have such a large consortium, a long list of opportunities where things can be made even better than they were before. So what we saw was rapid changes in the vaccination policies. Trial protocol amendments is how we react to that, but they take their time. It's not that they would be just waved through or something, because they need to be scrutinized so that it's always safe to be on a clinical trial and VACCELERATE. And we had then to adapt sample collection management processes. There is a lot. If you might make a subtle change in the protocol, there is a lot downstream that's happening. And indeed, we had temporary shortages, like others, of sample collection material, just tubes, for example. And then we know now, and the EU or European Commission knows that they actually, when they fund a clinical trial, and there are always leftover samples in clinical trials, and you don't want to destroy them. So ideally, you do what we did and get informed consent from the participants in the trials that these leftover samples can be used for further research, but that needs funding then, of course, and just the storage needs funding because somebody needs to keep all the samples under proper conditions and accessible and findable. Not only the data, but the samples as well. So the VACCELERATE team demonstrated resilience, and that is the entire VACCELERATE family. So it's not the coordination office team, but it's the entire VACCELERATE family and collaborating system. Demonstrated resilience. We found always solutions. I would say exceptional problem-solving skills, ensuring the project success and maximizing the outcomes. Having said outcomes, we are looking, as said, into the future, and we want to address or prepare for future pandemics. One way is not only to keep the VACCELERATE activities up and running, but one is that we applied the most modern way of planning and conducting clinical trials, which is the adaptive platform trial, which is the most flexible version of a trial where you can add arms or close down arms based on results from the trial. So it's a paradigm shift towards a learning system, and we wrote a paper on that, a white paper that is open access with all these experts on the slide, on that photo, a good year ago. So that can be used. So we are not, with our learning lessons, we are not hiding them. We are publishing them so that we maximize impact. Outlook beyond the 27th of January 2025, when the funding will stop. Well, VACCELERATE proved to be vital in supporting Europe's preparedness for current and future pandemics by promoting a collaborative approach to that field of vaccine research. And it serves as a model for international cooperation in clinical research, even functioning during emergency, not only in peacetime, as it has often been called. And we have a sustainable volunteer registry and site network and study news course, by the way, even after the end of the funding given by the European Commission. We didn't use all the funds, I have to say, so quite some can be used for other projects. And the University of Cologne is sustaining the volunteer registry network and study news course and other important structures. So for more information on VACCELERATE, stay tuned and visit us at all these options here. We are gradually moving away from X to Blue Sky. So there will be a VACCELERATE handle for Blue Sky as well. And but that is moving during these days. In any case, info@vaccelerate.eu, and you will get a response same day with whatever your inquiries about, whether you want to learn more about the volunteer registry or become a site, or are interested in clinical trials in whatever aspect of the trials. Don't hesitate to contact us. Acknowledgements. The coordination office has been mentioned several times, the work package leads as well, and the national coordinators and everybody else, every group within VACCELERATE. And here are all the logos of all the academic institutions working with us. And here are some faces. That is the national coordinators. So in each country, we have one coordinator who is in charge of promoting, for example, the registry for the volunteers, or helping us with the translations so that it's appropriate translations, not only AI-generated translations for the info material for the volunteers, and of course the locals, the national coordinators, they know where the sites are that that can contribute, and that should be part of VACCELERATE. To just name these two aspects, but there's much more that the coordinators contribute. And the VACCELERATE Coordination Board is set up by the leads of the work packages. So all the complex work was separated into work packages and then allocated to experts in that respective topic. And you see the coordination board, and we do have a representative who is then in exchange with all the work package leads, and that is a representative of the national coordinators, because otherwise it would be a too large group to be flexible. And Pontus Nauclair, Professor Nauclair from Stockholm in Sweden has this position for a while and currently. And with that, I can say thank you to everybody who made VACCELERATE a success. And the last slide of whatever presentation is always not only thank you for your attention, but please join our volunteer registry. So I give you a few seconds to scan.
Now I think it's time to ask Oliver if we have any questions with regards to what Oliver just presented, or if you have some suggestions. And actually, we have already one suggestion with regards to the volunteer registry from Francois, who actually suggested, Oliver, that it would be nice to invite the volunteers to connect with the European Vaccination Information Portal, since they can be updated about the different types of vaccine. And of course, this information is also translated in all European languages, so we overcome also the language barriers. And thank you, Francois. This is a very good idea. Oliver, what do you think?
Yeah, I fully agree. It's a very good idea. I'm not sure whether we have the link already on the VACCELERATE EU website. Janina would know, maybe it is, but even in any case, we could put it into the next newsletter that we send out to the volunteers.
And actually, well, we have to also inform the participants that we have created the VACCELERATE promotional toolkit and educational toolkit, where we use some, let's say, interactive educational cards. And of course, the European Vaccination Information Portal was included as one of the sites that can be reached out by the volunteers. So we have already done it, but I think it would be nice, as you said, to include that in our forthcoming newsletter. I don't see any other questions. Do you have any question or comments? I do see also from the people that have joined that are within the official, let's say, VACCELERATE partners, but also a few people outside the VACCELERATE who have also joined the VACCELERATE trials, so maybe to share their experiences. From my side, Oliver, I would like actually not to ask your comment on the words, actually your last presentations about the backbone of VACCELERATE, and you mentioned about making sustainable the volunteer registry and the VACCELERATE site network. I think this is very, very important. And of course, maybe we need also to emphasize that we have tried also to collaborate with other projects, with other networks, like, for example, the Verdi project. I see also Ali Jude. This was also one of the mandates, let's say, of the European Commission to collaborate and complement the work. And it was also very important that through your help and support, we tried also to, in a way, foster the evolution and the creation of an MPOX registry within the Verdi project, which was also very important, I think.
True, I didn't mention the MPOX work we did and that we published, so it's openly accessible. But then the problem was that there was no flexible response mechanism you need at least a little bit of funding because you cannot ask everybody to volunteer. I mean, the professionals to volunteer and add to their work burden documentation or taking place or taking part in a clinical trial. That is kind of difficult. So you need some seed money there. And although we have leftover money, leftover funds, we couldn't mobilize them within the framework, within the funding framework of the European Commission. And I'm sure that each and every step that we had to go through is well balanced and reasonable, and there are reasons for each step. But it needs a separate setup for emergencies, and so the flexibility for emergencies was not there as we see it for other emergencies. If there is a wildfire in a country in Europe, then you see, I guess, that rapidly all the offers of neighboring countries to send the firefighters and etc. So that type of flexible reaction we need for these emergencies. I know that the European Commission is working on this, and we all have heard of this, I guess, and so we will see improvement there. But that is all test cases, and nobody's being VACCELERATE for being slow here or there, because we always know exactly how many days which step took, and it's just things that we were beyond our sphere of influence, so to say. Yeah. So I'd like to mention one more where we now connect to with the volunteer registry. We know how to approach people and what works, and we know definitely what does not work. And so many things we tested and cross-fertilized between the countries, and so we have a rich base of what does not work and how do you reach people for clinical trials. And there is there's an IHI project ready, which is coordinated by our Spanish colleagues, by Professor Barovia being the consortium lead there. And this is about underserved populations. So it's about everybody you never find in clinical trial. So we know these things like clinical trials on heart attacks only done in men, not in women, and things. But that is only the tip of the iceberg. That is what everybody knows, but there is a lot more. And for those clinicians on the call, you may have a similar experience. What I did when I did rounds on ICU, on intensive care unit. It was not people who were for 7 generations in Germany at some point who were being treated there, but I had the impression, I don't have statistics on that, but on my personal statistics, so to say, but there were populations, there were groups, even in a city like Cologne, groups who were not reached and by vaccines, so they had no vaccine. So for them, it was like pre-vaccine era, and they were then really sick and went through all the trouble and all the threats and all the burden that we all shared only in the first wave, so to say. And so we know that there are populations, we identified populations we did not reach. So we can tremendously, as a VACCELERATE family, consortium is over by January 28 or so. So family, we will contribute to identifying populations and reaching populations in the Spanish-led Borovia consortium, so it's already.
That's true, Oliver. I would say that this journey continues in a way, and it's very important, as you said, to focus also on underserved and underrepresented populations with a lot of lessons learned from VACCELERATE, bearing in mind that 2 out of 3 trials were focused on underrepresented population, elderly and pediatrics. And as you mentioned, these are the only investigator-initiated clinical trials on those populations. So I think that there are a lot of lessons learned from VACCELERATE.
And it's the only randomized strategic trials. It's the only ever done in the age population, regardless of who's the sponsor. We know that there were pediatric studies on the vaccines, but they were not randomized versus another vaccine or another schedule as a Patricia study, where and so all three questions are still valid. And that was something where we were really a bit stressed when we were tasked with run three studies, invent three studies. It was like, oh, once we have the results of the studies, that is like really the future. So will the question still be valid? And I have to say, I'm really proud that we selected these three topics because there was criticism on why these three, how do you, etc. So you may remember. So what we did is we just polled the experts. We asked the experts, work package leads, national coordinators, other experts, like we did with what's the next pandemic. We polled them and said, what is the question you think is still valid in a year or so? And there came multiple answers. We did choose the three that were the most often chosen. So we did just use the top three and that's it. And so ask the experts. That's another lesson learned, but that we knew 4 years.
That would be also my last, Oliver, this would be my last, let's say, comment, like from you as the coordinator to close also the meeting, what could be the major lesson learned from VACCELERATE and a positive message to close the webinar today?
Well, there's a lot of collaboration, and if there is a crisis, then everybody works together. Okay, so we need to have that spirit between crises, in between pandemics, in the interpandemic time. That is how we call it, right? And we need the same spirit and live on that spirit between crises. Then the next crisis will hit us much less hard.
Thank you, Oliver. We keep the positive message of collaboration. And with that, if we don't have any other comments, there is a lot of, from Peter, also great work and presentation, Oliver. Keep up the right spirit.
Yeah, together.
So thank you all very much. Special thanks again also from my side and my team to Oliver and the coordination office. And Oliver, as you said, we will continue our efforts and our collaboration. It was a true pleasure. If you just want to close the meeting.
Me? Okay.
Yes, please.
Yeah. So indeed, I want to extend my thanks to the coordination office, specifically Kerstin Albus, Fiona Stewart, Johanna Boskern, Pauline Wipfler, Ulrich Bethe, and everybody I forgot now. It's always difficult if you start a list. Yeah. So all these fantastic experts and all these PhDs and medical doctors that helped in the coordinating office. Yeah. So great team. Thank you.